So I do want to go ahead and introduce our team and our speakers today, who are going to be talking about bridging the gap between dentistry and nutrition, interprofessional integration of nutrition education among dental students, dental hygiene students, and dietetic interns in the clinical setting. From the Texas A&M College of Dentistry, we have Jane Cotter, Tristen Lovekamp, Lisa Mallonee, and Peggy Timothe. And I love that this is a cross-institution collaboration with the Baylor University Medical Center with Ashley Mullins and Susan Roberts. So I would go ahead and turn this over to them to go through their presentation. Lisa, if you want to go ahead and share your screen, then you can take it away.
All right. Well, thank you, Christine, and to the IP Echo team for having us today. We're glad to be a part of this initiative and just sharing the various modes of delivery that's occurring campus-wide at our university. So we hope today, by the end of this, that we can articulate the value of our interprofessional education in nutrition as it relates to oral systemic health, just identifying some ways to implement interprofessional initiatives to meet those accreditations and requirements for both dietetic, dental, and dental hygiene programs. And lastly, just describing how professionals in health and other fields can collaborate and integrate clinical care and public health interventions to optimize population health. So, getting stuck.
We're all learning Zoom lessons as we go.
I know. Okay, so I start out with this definition. Over the past couple of webinars, we've defined interprofessional health, and I really like this term, interprofessionality. And the definition is the process by which professionals reflect on and develop ways of practicing that provides an integrated and cohesive answer to the needs of the client, family, and population. It requires a paradigm shift since interprofessional practice has unique characteristics in terms of values, codes of conduct, and ways of working. And I guess this spoke to me because this paradigm shift or shift of thought to learn from, with, about, to or more professions, it's really been the hallmark of my personal career path, where I'm dually licensed as a registered dental hygienist and a registered dietitian. And so the intersection of oral health and nutrition, it's been the foundation of my career. So when we look at what's available throughout policy and position statements with, our across our disciplines, we see that, there's many bodies of evidence where we have policies and position statements. But I guess the thing is that even though we have these policies in place, there's still a disconnect between, those positions and what we're actually implementing into practice. Additionally, we have, within our own individual disciplines, our professional directives and competencies. With dental and dental hygiene, that's the Commission of Dental Accreditation. And then with dietetics, it's that Accreditation Council for Education and Nutrition and Dietetics. While each of these individual professional directives and competencies remain the distinct domain of each of these professions, accreditors are really working hard to ensure, that individuals' actions are not, providing barriers to those development of quality IPE at constituent institutions. And so we see here this long-awaited guidance on developing quality interprofessional education for the health professions, which was released in 2019. As of this publication, 24 accrediting bodies, which includes dentistry and nutrition and dietetics, and very likely many of you on our call today, your accrediting bodies as well, are HPAC members. And so I think it's a really important document for all IPE practitioners to read, and we encourage each of you and all the participants today, to take advantage of this. So while cross-accreditor collaboration is being established, though, let's look at the individual accreditation language. So Dr. Timothe is going to provide us, first of all, with an overview of dental.
Thanks, Lisa. The accreditation standards for dental programs are written for broad applications. Nowhere in the standards do the terms interprofessional or interprofessionality appear. However, the standards firmly support what you can see here highlighted in red, that dental students are trained to communicate and collaborate with other health practitioners to improve patient care and outcomes. Next slide, please.
So similarly, with dental hygiene, we see that our standard for interprofessional education mirrors that of dental. Exactly. However, unlike dental and dental hygiene, we actually have a standard for where nutrition is indicated as well. And typically this, shows up in the biomedical science content as well as other areas of our curriculum. Additionally, the American Dental Education Association, which is our guiding body for academic dentistry and allied education, it provides a curriculum guidelines, which is more of a framework for course content. It does not dictate what we have in our curriculum, but it does give us some direction and foundational support as to how to incorporate. And I was privileged to be on the revision of the draft that we have presently available to us. So I ensure at the Chris School of Dental Hygiene, we are integrating nutrition not only within the allied education within our own curriculum program, but also in the dental curriculum as well. So now Ashley's going to tell us a little bit more about what's going on with dietetics.
Thanks, Lisa. So the Accreditation Council for Education in Nutrition Dietetics is the accrediting agency that establishes core competencies that are required to become a registered dietitian nutritionist. And to become a registered dietitian, our dietetic interns have to complete 1,200 hours of supervised practice. And these hours are conducted in a variety of settings, including clinical, management, and community. So in collaboration with the dental program, our interns are able to achieve competencies both in the clinical as well as the community setting. And these are focused on the competencies of functioning as a member of an interprofessional team, as well as conducting a nutrition-focused physical exam. So the nutrition-focused physical exam, or NFPE, is an essential skill that a registered dietitian uses to evaluate nutritional status and identify things such as muscle loss and fat loss, which are key findings associated with malnutrition. We've also incorporated the use of objective structure clinical examination into the dietetic internship, which uses a standardized patient case to assess dietetic interns' competence in nutrition assessment, as well as this nutrition-focused physical exam. Next slide.
So how do we put all this together in practice? In 2004, I was invited to join the internship program as a preceptor. As Ashley was saying, the interns participate in the internship program at Baylor. It's a 10-month-long internship program where they must complete hours in the area of food service, community, and clinical. So initially, we started our collaboration with me introducing an oral health and nutrition lecture. It's introduced during that first week of their internship beginning in August. And then throughout the course of the fall and the spring semester, the interns will come and spend 3 hours with me on a clinical rotation, and where they're kind of applying that information. Also during that intro lecture, I'm giving them guidelines about the internship or the rotation with me and things that are expected. So in 2010, Susan Roberts, who is actually on our platform with us today, she's the dietetic internship director, and she approached me about incorporating content on the nutrition-focused physical exam. She had attended a program with what is now Rutgers, and where they actually covered extraoral and intraoral exam. It was a dietitian working with, in combination also with the dental program there. And she was wondering how we could actually add that to our content. So it was just natural for me to go to my colleague, Jane Cotter, and ask her to join this, with me, because she did her thesis research on oral cancer. She has, worked in private practice, oncology, dental practice, and she has an extensive knowledge base where she was also very instrumental and establishing a dental clinic in the Charles Sammons Oncology Outpatient here on our Dallas campus. So she, was brought on board, and she added that lecture and hands-on component. She does that hour lecture, and then I do the kind of join her for that hands-on delivery of that content. And then bringing us to present day, we did a pilot in 2020 with the dental students. So in the fall of 2019, Dr. Timothe and Tristen approached me about a grant that they were, working on, some different pieces of that grant, looking at IP education. And they were wanting to know how we could, what was going on, or how we could kind of translate what was going with the dental hygiene program, perhaps we could kind of mimic that with the dental students. So I'm going to let Peggy now tell us a little bit more about what they actually are doing with the Texas Recruits and Retains.
Great. So in Texas, many people have access to good oral care, yet there are parts of the states, particularly rural areas, and population groups like minorities and seniors who don't have the same access. So in 2018, the state of Texas received a grant to develop the dental public health workforce with the goal of increasing providers for underserved areas defined as dental health professional shortage areas, or DHPSAs, or metropolitan underserved areas. In the entire state of Texas, there are only 3 dental schools currently. All 3 schools are part of the projects, and we all have the same objectives. One of the objectives is to provide opportunities for our students to be involved in IPE experiences. The first year of the grant was really a planning year and looking for partners. For us at Texas A&M, most of those projects that we planned out year 1 turned out not to be feasible. It's not until we looked in our own building that this pilot came about, that I learned that Lisa had this program for dental hygiene students and dietetic interns collaborating for over a decade. The evaluation component for the grant includes us explaining how well our students gained knowledge and skills in IPE. Next slide, please. Here, Tristen will explain about the assessment tool.
Thanks, Dr. Timothe. So back when the grant was written in 2018, it was decided that the IPE activities would be evaluated with a self-reflection paper. So the assessment that you see in front of you, that's the rubric we use to assess those self-reflection papers. And luckily, we didn't have to reinvent the wheel and come up with all new tools. There were some that already existed. So the self-reflection paper we took was a modification from the California Interprofessional Education Research Academy. And the rubric in front of you is a very, very distilled version of the ICAR rubric from the Academic Health Council in Canada. So the original reflection paper took the 4 IPEC core competencies, and they had students reflect on those. What our team did was we looked at the self-competencies that IPEC provided, and we decided which ones our students would be able to gain from this particular activity, and so that's what they reflect on. So those are what you see in that left-hand column there. Those are what students reflect on. And the last 3 rows, those are what we actually report to our funders. Next slide, please.
So the format and structure, we've kind of alluded to some of these steps, but it just kind of breaking it down into how we prepare the interns, the dental hygiene, the dental students, and just the time factor involved. So there's an introductory lecture to the dietetic interns during their orientation week, which is, my piece of it is an hour where I'm introducing oral health, nutrition, and just the application to patient care. Then Jane Cotter joins with her hands-on lecture where she's talking about the nutrition-focused physical exam, and then together we actually go through this with the interns, and they've literally only known each other for about 3 days, where they, kind of get a hands-on approach to applying these with one another. Prior to the rotation with me, there's required readings, there's a food record. which, typically a food record is just gathering dietary information, but I actually have them include oral hygiene information as well, so that we can sit and reflect on it at the end of the appointment, just how not only their diet affects overall health, but from a perhaps caries risk management, some of their dietary factors could play a role. The actual clinic session is 3 hours. I'd love to have more time with them, but there's 12 interns, and they're paired up with me in groups of 2 for 2.5 hours. They observe, they participate, and they collaborate during the patient care appointment. Half hour of that, they work with me as the dental hygienist and the dietitian. It's sort of a faculty debrief, and then together we go over that 3-day food record and make them aware of perhaps some of their habits that may put them at risk for oral disease. And then lastly, there's post-reflections, which Tristen just shared what we do for the IPE nutrition reflection. Additionally, I require the students for the dental hygiene rotation to do a reflection based on that 10 months of their rotations in all the different areas, how they saw oral health playing a role in regards to implementation of medical nutrition therapy and diet. So now Ms. Cotter is going to tell us more about the application piece that she does with the nutrition-focused physical assessment with the interns.
Thank you, Lisa. I participated in this part of the presentation in part because of my experience in managing the dental clinic and the Baylor Salmon's Oncology Clinic. Not only are the oral cancer patients affected by the cancer treatment, but all patients who receive chemotherapy or radiation therapy experience oral complications and have nutritional challenges. While at the Salmon's Dental Clinic, I work closely with the dietitians in order to provide comprehensive care with these patients. So as Lisa said, I give a lecture, and then we do this hands-on presentations where the interns get to meet each other a little bit more intimately. It's always a fun experience for them. But how to conduct an oral examination. We outline the oral signs of malnutrition, oral infection that may indicate a change in the patient's health, and we discuss motor and sensory nerve problems that may affect the patient's ability to chew, swallow food, or even desire food. We address patients who may be edentulous or have removable partials and dentures, and how that may limit a patient's ability to manage food. Patients will find a way to eat with or without teeth, but they may not be making good nutritional choices. So finally, we stress to the interns that with this oral exam that they're not identifying or diagnosing any kind of oral condition, but just recognizing deviations from health and how to refer those patients out to other healthcare providers, and the importance of interprofessional collaboration to improve patient outcomes. Next slide. Now, Ashley is going to tell us a little bit more about the competencies.
So as we mentioned, the lecture and the hands-on skill, we have a culminating experience at the end of the clinical orientation for the dietetic interns that utilizes the OSCE and the standardized patient. And this patient presents undergoing chemotherapy and decreased appetite, muscle loss, and mucositis. So as part of the intern performing the physical exam, as they examine the mouth, the standardized patient provides them a picture of the oral mucositis. So we use this as a means to, not as formative assessment, but more evaluate their self-confidence and their comfort level with performing these skills that they've just learned, since it is conducted at the beginning of the program. And as Lisa mentioned, the reflection paper, just some common themes we've identified is the interns are able to make the connection between oral health and adequacy of oral intake within patients undergoing chemotherapy or radiation, as well as relationships between food and beverage consumption and sugar content amongst pediatric patients, and just the risk for dental caries during their rotation in the women and children within the community. Next slide.
So rather than going through cases, we're actually going to just talk about the process we do with the dental hygiene and the dietetic interns. This is an actual image from, I believe it was 10 years ago, with a hygiene student and one of our dietetic interns. And ideally, this appointment should be scheduled with a senior dental hygiene student who is starting with assessment, because we want to allow the intern to observe the comprehensive, care from beginning to end. And then it also allows the intern to participate throughout that detailed process, where they're observing that intraoral, extraoral exam that they participated in as part of the nutrition-focused physical exam, but they don't themselves have to carry this out. They're watching the dental hygiene student. I let them work independently. I don't hover over them until this part right here, where they're actually going through the diet, where I allow them to, kind of feed from one another. The thing I ask the dental hygiene student is to talk through everything he or she is doing. And then conversely, when it's time for the diet practices questions that typically the hygiene student would ask, then the intern takes over, and the dental hygiene student inputs the information into our electronic health record while they are observing those motivational interviewing techniques that the dietetic intern is more comfortable with as far as eliciting dietary information. And so we took this same thing that we did right here, where we kind of mimic this together. And you notice, as I said, I come in where the piece that I'm allowing them to collaborate with one another. Would this patient, benefit from further dietary education? Would they benefit from being referred out to a licensed dietitian and or physician for more comprehensive care? So the same model is what, we did with the dental students. We plan to do 2 pilots in this March, but we were only able to do 1 because of the COVID situation. But these pictures here, as you can see on the left-hand side, that's the dietetic intern, and she is, using those motivational interviewing techniques to ask questions and to elicit information. This patient was just so engaging. The next is that, the dental student is over to the right, explaining a little bit further about the process and maybe trying to relate the dental and the dietary component. In the upper, the middle center portion, you see us looking together, the patient, the dietetic intern, the dental student, myself, at, what's going on that intake record, and, as far as treatment planning, what would be the most beneficial for the patient. And I included this one on the bottom center just to show that, we're not stressed while we're doing this. We're having lots of fun, and we're all learning from one another. So it's just as much a learning process for me as well as for the patient, the intern, and the dental student. So that IPE or reflection assignment that Tristen was referencing as far as that assessment tool, with that, what we asked is, you saw it on that assessment piece, we're wanting to know what was their reaction to the experience. What did they enjoy? What would they have changed if they could repeat it? And then they're kind of grading it based on interprofessional communication, values, ethical practice, goals, and responsibilities, and just which one of those knowledge or skills they feel like they're going to take from this experience and apply it later on, either during their academic career and or professionally. Interns and D4 students both had such positive responses. And I mean, it really was a great experience. The interns felt like that showed both the dental and the dietetic student more about each other's professions and expertise. And they realized that, the importance of the disciplinary team. I love the D4 students' response. They said, before this exercise, I would have said dentists and dietitians have very separate roles and responsibilities, but now I realize it should be expected of us as dentists to concern ourselves with patients' nutrition. And that, the other student that we worked with, that I don't have an image of on the previous slide, was, he said, I think more interaction between the dental student and dietetic intern should be encouraged. So, they were all very, very positive. I didn't just pick my favorite ones. There were really a lot of favorite ones I could have included on here. So lessons learned. We know, as with, any great thing, there's imperfection. So the process comes with, those imperfections that help us to learn. Scheduling is probably the biggest piece for, as I mentioned, for the dental hygiene, as well as for the dental students. We want to make sure it is during the senior year of the dental hygiene, and then either the 3rd or the 4th year for the dental students. because they're more experienced at this point with their assessment skills. We also want to make sure it's on an initial assessment appointment and or OD screening or intake appointment for the dental student. Another thing is I try to make sure the faculty, the students, as well as the patients are well informed about the experience. I send out an email prior to the intern's date that they're going to be in clinic with us. I introduce the interns to the faculty that will actually be in clinic with us that day. And then prior to actually letting them participate, I actually speak with the patient, let them know that I'm not only a dental hygiene faculty, but also a dietitian. I'm affiliated with the medical center, and ask their permission to allow this. And I've actually never been turned down. They're always very willing to have, someone, that dietetic intern join in on the fun of the appointment. And then lastly, I'm just gonna have Dr. Timothe tie up about awareness of collaborative partnerships. She kind of alluded to this earlier, but Dr. Timothe?
I guess the lesson is that there are so many opportunities for collaboration and partnership. As part of the grant, we had to spend a year planning, and we worked really hard, and we tried so many projects that in the end really didn't work out. And it's not until, I want to say, we were a little bit desperate that we looked in our own building, and then Lisa had this project that was well established for well over a decade. So I think forums like this for faculty to just even present ideas, pilots, plans, and look in your own building. And we had just such a great resource. And to get out of, like, one of the discussions we had was to get out of the silo thinking that, collaboration just has to be this, or a dental student can only be involved in this type of project because it's directly related to dental, to just think broader. Thank you.
All right, so now is when we turn it over to our audience. I guess Chris is gonna let us kind of guide us with the chat. If someone wants to ask questions, I just encourage lots of conversation if there is any questions about any of the information provided.
Yeah, thanks to the team for that great presentation and really broad overview of what all you're doing. We do welcome questions in the chat, or if you want to just speak up or raise your hand. We'd love to hear what questions you have about their work. I think Shannon Mitchell has raised her hand. Shannon, why don't you give us your question?
Great. Maybe I missed this, guys, but hey, great presentation. Really learned a lot. So thank you for inviting us.
Thank you.
What year, you were talking about third year and fourth year dental students, senior dental hygiene students. What about the dietitian? I don't know much about their curriculum. Are they, is it a 4-year program? When do they come on board as well? In what year?
I'm gonna let Ashley or Susan speak to this in a moment, but they are, by the time, I got a coordinated degree in nutrition, so my internship was weaved into my master's degree program. But this particular internship they've already come in with their Bachelor of Science in dietetics in an area, and then they're finishing up with this internship. So Ashley or Susan, would you like to add to this?
Sure. Yes. Universal to become a registered dietitian. Currently, it is a 4-year degree. However, our profession is currently in transition to having a master's level requirement. And then there's the supervised practice component. So our interns, dietetic interns, when they enter into this experience with dental, they could be anywhere from the beginning of the dietetic internship, completing supervised practice, or the end. Typically, it's probably the beginning to the midway point of the program. So it's 1,200 hours that are required for interns to complete. And so that can be achieved over different durations, just depending how their degree requirements, if they've already been achieved or if they're coordinated like Lisa described.
Did that answer your question, Shannon?
It sure did. Thank you.
Right.
I'm noticing, I'm wondering if Amal Norelden might have something more to say about her perspectives on this IPE project.
Yeah, it's a great IPE project, and I'm really glad it started in our school. And I have a question for Dr. Timothe as well as Lisa. How do you see we can really implement this IPE to be like a constant approach within the school? Because it's a great project. We teach the students nutritional aspect, and actually Lisa teaches the diet lecture in my course for the D1s, and then we move to the D2s where we do some nutritional counseling, but it's from our own humble knowledge about nutrition related to caries. And we do role-playing models and stuff like that within a class. But in the D3 and D4, having the patient and having a dietitian as well as the someone from the dental hygiene, and it's really beautiful, and I can see huge potential there, especially if we have medically compromised patients, where one faculty, Dr. Rubin from our biomedical department, mentioned that obesity is a problem and how we address this in nutrition and stuff like that. So how would you, that's a long question, I'm sorry, but how would you see this is coming into our own clinics and how we can implement this so I can help you with this step?
Do you want me to answer, or Dr. Timothe, you want to speak first?
Thank you, Dr. Noraldine, for such a great question. In the long term, when we have a project like this going, ultimately we'll be able to see good outcomes in terms of patient improvement in their oral health and their overall systemic health. So it's really a project that we need to have a commitment that we're going to carry through for the long term, because in the short term, involving a project like this, it would mean increasing that intake appointment and everything that we have to do for our patients. And for our pilot, we had to be very strategic not to interrupt the normal flow of clinic practice. However, it's a great project, but we need a little bit more buy-in in terms of understanding how it's going to impact patients' health ultimately, and the amount of time that we need to have this to be more consistent for all the patients to benefit. Lisa, I don't know if you have anything to add to that.
Always. Now, I think that there's definitely, I think the buy-in piece is key. I think as we go to, or move to the group practice model, that it is an ideal time to consider this further. But when I first started incorporating it, even within the dental hygiene program, I spent time at Tufts, and at the time, Connie Mobley, who's a dietitian, was at University of San Antonio, and they were doing implementing nutrition with the D4 students, where she actually, through a grant funding, had a second dietitian where the D4 students would actually meet with one of the two dietitians, and then they would actually do a counseling session. I believe it was with a denture patient, and that they would observe that process. So I think the buy-in piece is where it's key, because that's where we were just piloting this. We found, again, and that's where I said it's important to have faculty involvement. So they're kind of, not thrown in at the last minute, that everyone can actually come to the table and talk about where would this fit in the clinical curriculum? How can we make this work? Because there is tons of evidence in the literature, in regards to that oral systemic link. There's also other models that we can look at. NYU has incorporated dietetic internships and dietetic interns in the pediatric residency program. We can even models of care relating to medical students and dietetic interns. So I think there's many things that we can look at to mimic and maybe translate into our own, into our clinical setting as well.
Thank you for your answer. And I believe that we're gonna, when we come back to our beautiful building, we're gonna have a meeting, because I'm so excited about what you did, guys. It's beautiful. I see Dr. Timothe every day. She's a dear friend, and she never talked to me about this beautiful idea, because I know it's running in there. And yeah, I'm very fortunate to have both of you in our school. Thank you.
Thank you. We're fortunate to have you.
So Ralph Montoya has a question. Ralph, why don't you ask your question? You might have your microphone on mute. Or perhaps he stepped away. Well, I'll go ahead and ask it. This is important in our global world. What languages did you use? Were they only in English? Was this English and Spanish?
So that's interesting. Yes, we only used English when we were doing this, but as another piece that I do with the dental hygiene students, where they actually have to identify a patient whose nutrition habits coupled with oral disease risk factors increase their risk, then our bilingual students actually do translate into Spanish. And we have one bilingual faculty that I have to assign them with, because I can say a few things. I can tell them to open wide, close, but I'm not very good at listening to the dietary aspect of it in Spanish. But that's a great question. And we also did have them translate one of the food record into Spanish, so that we could actually send that home to patients.
What other questions might folks have? Why don't you go ahead and put them in the chat, and I'm going to ask one of my own. If I understood correctly, the OSCE was for the dietetic interns, correct?
That's correct.
I'm wondering what you might imagine an interprofessional OSCE might look like for this.
That's a great question. We've actually discussed that at times, how we'd love to do something like that. We've seen some models where we have the luxury of being here at a teaching hospital at Baylor University Medical Center. So we've even thought about, if there was a way after assessing the patient, there would be potentially speech pathologist students, if the patient had dysphagia. So it could easily be extended to other disciplines as well, whether it be nursing students. This case was just more of an acute care type patient. However, you could build the case for any type of setting. It could be more in that outpatient setting that could work with the dental program as well. So there's so much potential. We'd love to do some more with the use of the OSCE. Most of as a dietetic intern, the great thing about the supervised practice is they're actually getting the hands-on experience to touch patients and see patients. So the use of the OSCE as part of supervised practice it's been done in dietetics, but it's not as prominent as a means for formative assessment, because they're actually we have preceptors here side by side with them, being able to assess the patient with them as well. It is a lot of fun to do it.
We've had some hallway discussions around Texas A&M about interprofessional OSCEs, so I'm always curious what others have to say about them. Thanks for that. Lisa, you mind to share perhaps some of your questions?
Sure. Just some of you have been kind of asking, but how do you envision implementing this at your institution or program? Do we have folks from the School of Nutrition?
So we did have some folks in nutrition. I'm not sure if they're from our School of Nutrition or maybe at another institution. I'm wondering if North Carolina might be able to envision implementing something like this.
Well, I mean, the School of Public Health, where I got my master's of public health with that coordinated degree in nutrition, is right across the street from the dental school. And Shannon Mitchell or someone else on the call could probably add to this, but I think there has been, some collaboration and between the institutions, and I'm certain they're very progressive, so that it would definitely be something that I know when I was going through my internship, every time we have a guest speaker, I'd raise my hand because I wanted to know how can we combine nutrition and dentistry. So that was 20 years ago, but I know they have lots of forward thinkers.
Lizette Vasquez, why don't you tell us a little bit of about how you might like to implement this at UT San Antonio, because you also have a College of Dentistry there and dietetics.
Good morning. Can you hear me?
Yes.
Perfect. Thank you. First of all, I really enjoyed this time with everybody, and it was amazing information. So this is something we would like to implement in the near future. We are the University of Texas at San Antonio, UTSA. We are a sister affiliation with the UT Health Science Center, or UT San Antonio. And we have already started to do some interdisciplinary work with the nursing school and the pharmacy school. And so this is another new area that I would like to start to consider and work closely with. So the information y'all provided was excellent and amazing, and I may be following up with you guys as soon as we kind of get our subnormalcy, I guess, in the next few weeks or months. So I'll be trying to think through this.
That's great. Absolutely.
That's great. As I mentioned for the grant, it's for all 3 schools. They have to do similar projects for their students. So there is an IPE opportunity with UT San Antonio. So that's
Perfect.
Great.
Thank you.
And I noticed Sarah and Shannon from UNC may have some input on implementing this at their institution as well.
So yeah, I'll give you a little bit of background from UNC. A couple years ago, a major thing happened at UNC where we got a IPE provost for the Health Sciences Center. And when you get a provost level, then some money can start talking. So, and Sarah, chime in at any time. Sarah's one of our graduate students doing her master's in dental hygiene, and has worked on a bunch of IPE projects. One project that I work on with the School of Medicine is in aging. And we have been a part of that project for about 8 years now, where we bring in 10 different disciplines over 2 afternoons and for 3 hours and discuss some cases and, again, get to know about each other. And it made me smile when you were showing your things about the dentist saying that they wanted to, get more responsibilities, these kinds of things. We had an incident where we do a reflection piece as well, and a dental hygiene student and one of the nutrition students was talking about, at first the nutritionist felt like the dental hygienist was stepping on her toes, but then in reflecting, she was like, we looked at it from a completely different perspective. She was looking at it from caries and dental cavities versus me looking at how many calories they needed. And I wasn't even thinking about how much sugar was in this. We really did learn something from each other. Another couple things, just real quick. We have a dual faculty from School of Pharmacy. So she has a dual position in the School of Pharmacy and in the School of Dentistry. We've hired a social worker. We've hired a nurse practitioner. So things are happening and so that's why I wanted to get on this and see what we could do in this. So I'll let Sarah talk.
Hey, yeah, so exactly. I mean, I have very similar thoughts. Like Ms. Mitchell said, I'm Sarah Liebman, and I'm a grad student in the dental hygiene program at UNC. And first of all, I love this experience that you guys put together. And it reminds me a little bit of this interprofessional admissions clinic that we recently started at the Adams School of Dentistry. And like Ms. Mitchell was saying, kind of with, we have nursing and pharmacy and social work right now who can come in and do consults, but the dental and dental hygiene students kind of do this coordination of care like the dietitian and dental hygiene, and dental students and you guys' model, where basically the different practitioners are responsible for different parts of the appointment, and you kind of observe each other working and things like that. And I love working with nutrition students because I feel like whenever I can speak with them and collaborate on treatment plans and things like that, they always we both have a lot to add that the other doesn't necessarily pay as much attention to. And so I feel like a lot of times in terms of like advising patients on nutritional counseling and things like that, the outcome is always superior when you have those different types of perspectives. So my question kind of about this, and I think you spoke about this maybe a little bit, but I'm interested to hear maybe more about it, is that collaboration piece. So we have the different professions that are watching each other and things like that, but how much do the students in this model, how much did they get the chance to collaborate and kind of discuss the treatment plan and maybe like advise the patient in that regard? Did they have a lot of opportunity to do that, or is that an area that maybe this could grow a little bit more in the future?
It could grow more, but I only get 3 hours with them when they are scheduled with me. But as I said, during that 3-hour appointment with the hygiene, I'm going to use the hygiene as an example first, since we piloted the dental students. And during that hygiene appointment, it's, again, they're working more independently with one another. With hygiene students going through that assessment, the intraoral, extraoral screening, periodontal assessment, dental charting, and then the diet practices section usually comes after that dental charting. And then that's when the dietetic intern asks those questions. And then that's when I come in, where I'm just observing, because I've had, required some reading prior to that rotation, where they can kind of understand that application of what they're looking for in regards to asking dietary information in regards to oral health. And then I let them ask the information. If there's some things that are left out or probing questions, then I kind of, just kind of interject. But then I ask them both. I said, okay, what do you think? You think that, and that's, again, why it's important to talk to the patient beforehand and make sure they're on board with you having this conversation, about their dietary intake. And so what do you think? Do you think that this, we'll say Ms. Jones, would benefit from further, dietary, eliciting more information? Do we want to get a food record, perhaps send her home with this so we could actually have her come back and review this content? Is there any, kind of red flags that we would want to refer this patient out to perhaps see a licensed dietitian, for more, for just more dedicated care, and or a physician, depending on their medical situation. So that piece of it, we talk as a group, and then afterwards I meet with the interns and just ask them, so what'd you think? How did you feel about this? Did you, at what points did you feel awkward? Did it feel a nice flow? And much like that reflection piece that we did for the pilot, where they actually wrote down their responses, those are similar questions that I ask, and kind of just trying to understand more about, what they would have changed, what they would have done differently. And I think what I've always gotten from the experience in every single year that I've worked with the interns, it's an eye-opening experience. And it's always very positive in that they didn't realize, first of all, there's so much that goes into the dental hygiene appointment. And also, then they have a greater understanding, though, as to where, nutrition could play a role. And I make them kind of reflect on that, as I said, later on throughout their internship in other areas. So they do get an opportunity, but absolutely, it could grow. I'd love to see the opportunity of them rotating through various clinics. There's so many opportunity throughout our dental school that there's opportunities for them. Does that answer your question?
Yeah, that sounds great. And I agree. It's depending on like the IP, opportunity, I feel like there's different levels of room for collaboration. And I know that in my experience, it's been hard to kind of strike that balance, like when you're in front of a real life patient.
Right.
But it sounds
Yeah.
like you guys are absolutely on the right track. And I love the reflection pieces and things like that you guys have implemented. So it sounds really awesome.
Thank you.
Well, we need to wrap up. I want to thank all of our presenters for an amazing presentation. Thank our presenters and participants for a wonderful and robust dialogue. We didn't have time to get to questions from Kristen Cockrell or a final question from Ralph Montoya, so I want to encourage you to reach out to Lisa Mallonee, so that you can follow up on those questions. We again appreciate your time. Here is Lisa's contact information for the presentation. If you have any questions about ECHO, you can contact Dr. Beard or myself for the Office of Interprofessional Education and Research questions. We will be sending out a very brief Qualtrics survey just to get your input on today so that we can improve our efforts and offer more of these types of opportunities in the future. So again, thank you. It's 1 o'clock. We ended right on time, and we wish you a good afternoon. Take care.
Thank you.